Hello, everyone. Welcome to the webinar Lockdown Measures During COVID-19, How It Affects Persons with Disabilities. I am André Felix. I'm the EDF Communications Coordinator, and I will be moderating this webinar today. And I hope everyone is well, and thank you very much for attending the webinar. First, I would like to give some logistical housekeeping information. So you can find the link to access the real-time captioning on the chat box, which should be to your right. The webinar will also have international sign language interpretation, and you can see here Ferdinand and Lisa will also join us. Thank you very much to our sign language interpreters, and thank you very much also to Kimberly, our live captioner. All participants have muted microphones, and EDF controls permission to unmute. So don't worry if you're trying to unmute and couldn't, it's normal. For those that asked the open floor, I will mention their name and my colleague Raquel will unmute you. I will add those that will speak in the open floor shortly in the chat box. In case you face technical issues, you can also ask my colleague Raquel through the chat box from now on. Please, also, if you didn't enroll to speak on the open floor, but you want to share now, feel free to signal us, again, to the chat box. But priority will be given to those that indicated in the registration list. So I will add the speaker list for the open floor part now. If you have other questions, feel free to start asking them to the question box. So these questions will be asked at the end to speakers during the Q&A time. The webinar will also be recorded, and we'll share the video with subtitles afterwards with all participants and through our website. The recorded video will not have the names of the attendees. Now, in terms of the topic, so during this webinar, we'll have 4 speakers. The first speaker will be Mr. Albert Prévos, who will share the situation in France. As you may know, France had quite a restrictive lockdown measures that have been in place for some time. Then I will read a prepared statement by Ondrej Folk from the Czech National Disability Council. Unfortunately, Mr. Folk was not able to be with us today, but he has a prepared statement and I will forward any questions you may have. Czechia had very restrictive measures and, importantly, was one of the very first countries that plans to reopen. Apologies. Milan Sverepa, Director of Inclusion Europe, will then share the impact of this pandemic and of the lockdown measures on persons with intellectual disabilities, and Aurélie Balanger will do the same about autistic people. So before we start, I would like to thank our interpreters, Ferdinand and Lisa, again, and also our live captioner, Kimberly, and also our speakers for taking the time to be here, and for all your ongoing work regarding the response to this pandemic. I will now give the floor to Mr. Albert Prévos.
Thank you, André. You asked me to speak of the role of DPOs during the lockdown crisis, during this period. The health crisis currently affects 10 million French people with disabilities and 8 million carers. But when I speak of carers, I mean helpers. What do we say in French? Aidants. Everybody who help people with disabilities, parents, professionals, and not only medical staff, you know. For most of those people, the epidemic period and the lockdown that accompanies it accentuate the level of risk and difficulties encountered in daily life. They may be exposed to severe health complications, whether they live in ordinary life or in collective structures. French disabled people's organizations have been very active since the beginning of the epidemic, faced with the dramatically unpreparedness of the French health authorities. They have tried to disseminate and explain messages on barrier gestures to relay the difficulties encountered by people with disabilities and their families, and to find solutions with the help of their teams of volunteers, of employees who terribly lacked protective equipment, masks, hydroalcoholic solutions, tests, etc. In this respect, I would like to pay tribute to the tremendous commitment of the professional teams and accompanying volunteers. When we applaud in each of our countries these sanitary carers every evening, we are also applauding people who take care of people with disabilities. I think we will have to remember this after the crisis. DPOs acted on two levels in France, alerting the public authorities and carrying out concrete initiatives. On the first alert, they have asked for solutions for the public authorities on the following points. First, lockdown plunges people with disabilities and their families into total isolation and deep difficulties. Continuity of care, some of which has now been deprogrammed, and home support are essential. People with disability must not be deprived of the recurrent care they need and which remains necessary for their health and that of their families. The lack of breathing space solutions will accelerate the exhaustion of families. We must therefore have all the facilities to organize long-term respite solutions for carers. There is a very strong concern for people with disabilities about the idea of making a selection on arrival at the emergency room in hospitals and in the resuscitation rooms. The government must ensure that this is not the case. And we have also more concerns about educational continuity for students with disabilities. In order to alleviate the conditions of containment, of lockdown, DPOs have not only alerted the public, national and regional authorities, they have also taken immediately actions and initiatives, particularly in three areas. First, to ensure the continuity and effectiveness of people's rights by providing information accessible to all people with disabilities, in particular blind people, people with intellectual disabilities, or people with severe psychological disabilities. Numerous documents have been produced for this purpose, in easy to read and understand language, for example, and communication tools have been put in place to maintain regular contact with families and people with disabilities. Second, to accompany people with disabilities and their families at home, especially those who no longer benefit from home help or continuity of essential care. Home visits are organized to avoid the exhaustion of families and to break isolation. Several associations have thus created or strengthened their services dedicated to persons, for example, with autism. And thirdly, to guarantee the continuity of accompaniment, the organizations found themselves unable to provide their professionals and users with the essential protective equipment, had to find alternative solutions, accompanied by training programs. They receive, for instance, they must improvise protocols for liaison and care in health establishments. The organizations also reminded the government that it made a strong commitment to safeguard persons with disabilities in situations of risk and humanitarian emergency by ratifying the CRPD, Article 11, as you know. So the campaign conducted by DPOs among the population and the public authorities in the form of press releases, newspaper articles, radio, and more rarely television program was partly relayed by the media. Less than we would like, of course, but enough for the government to take into account the specificity and importance of the situation of people with disabilities. This awareness was demonstrated by a joint press conference by the Minister of Health and the Secretary of State for Disabled on the 4th of April. The Minister made it clear to us, to the organizations. He reminded hospital staff that persons with disabilities, I quote, must receive the same care as the rest of the population. Disability must not be a criterion for refusing care, whether we are talking about simple hospitalization or resuscitation. It was very important for us, And they've announced some measures. The setting up of a reinforced and real-time monitoring of the evolution of the epidemic in the specific sector of disability. Reinforcement of prevention measures in establishments and for people in services providing care for people with disabilities, in particular by carrying out tests. Supporting establishments and support services in the management of cases of COVID-19, in particular by extending the intervention of mobile hospital teams to establishments and services for people with disabilities, and the anticipation and organization of hospital care when necessary. This is a very important point for us, given the fears which seem to have been confirmed, unfortunately in some places, of selecting people admitted to intensive care units. So, the organization, the DPOs, are vigilant about the effective implementation of these measures, which are obviously applied differently from one region to another. But these announcements are serious support points to bring their claims to local leaders when failures are identified by the DPOs. Unfortunately, all these announcements have not, for the time being, resolved the major and dramatic problem that is still posed by the lack of protection, masks, gowns, hats, and tests, which undoubtedly has a greater impact on disabled people due to their fragility than on the rest of the population. There is still great uncertainty about the conditions of schooling for children with disabilities at home. Containment, lockdown, keeps them away from personal assistance and sometimes from a safe environment. It also increases the digital gap for those who had social vulnerability to their disability. Well, this is very quick, of course, but finally, I would like to say that discussions on the end of containment of lockdown are already underway in France. A first stage has been announced for the 11th of May. This is an enormous challenge for people with disabilities and for our DPOs. Organizations have been invited by the government to participate in the development of measures that will concern the gradual removal of disabled people from lockdown. Well, it's fine, but there are so many questions. What legal, medical, and practical criteria should be used to justify keeping the most vulnerable people in lockdown? How can we avoid the negative effects of a continued lockdown? How can we prevent the exhaustion of carers? What support should be provided for a safe return to social life, to work, to school? And I add that our DPOs must remain vigilant on at least 2 points. One, with the recession following the COVID-19 crisis and the widening of the deficits in the state accounts, the most vulnerable people should not suffer from budget cuts. Difficult. Second, the post-COVID-19 response must be comprehensive, coordinated, and carried out together at European level. We need a strong social Europe with real ambitions and resources in phase with the CRPD. Thank you.
Thank you very much, Albert. I will now read the statement of Mr. Ondrej Folk from the Czech National Council. So, on the 13th March 2020, the government of the Czech Republic declared state of emergency in the whole country. Schools have been closed, as well as all shops with the exception of groceries, pharmacies, drugstores, and shops selling medical devices. Visits in hospital and social care facilities have been prohibited. All cultural events have been cancelled. A general quarantine has been declared. To wear masks was decreed mandatory. At the same time, the government did not secure enough masks, so people had to start to sew their own masks. And there was a significant display of solidarity and mutual aid during this period. People producing and distributing masks and other protective material for those in need, or providing other help. Since the 1st of April, there was a gradual loosening of the restricted measures. For example, some shops have been reopened. However, certain rules must be strictly met, such as the mandatory distance between customers, the use of masks, and the provision of disinfectants by the shops. A timetable of loosening restriction has been set up until to the 8th of June. It includes partial reopening of the schools, of cultural facilities, restaurants, and hotels. At the beginning, DPOs were not consulted when drafting the restrictive measures. The government used the so-called Central Crisis Staff as its main advisory body. Some of the organizations advocated to the government expressing serious concerns, such as mask wearing, as a significant barrier for people using sign language or lip reading, or for people with autism. The necessity of accessible information for persons with disabilities, or the fact that the COVID-19 crisis is particularly challenging for persons with disabilities. A matter of supreme importance was to notify the government of the particularly bad situation of people in care facilities in residential institutions, which were rather neglected at the beginning. Eventually, now, in connection with the distribution of protective tools, of protective equipment, DPOs are being consulted and invited to important meetings through electronic communication. The state of emergency is still in effect, so the Czech National Disability Council takes part in video conferences and submits its own proposal. During the COVID-19 crisis, the Czech National Council managed to promote important amendments to legislative drafts, so that persons with disabilities and their families are better taken into account. It is, however, difficult to assess the impact of the viral crisis before it ends. the DPOs had to postpone or cancel a big number of actions, events, and projects aimed to benefit persons with disabilities, as the general confinement is still in effect. The exception to this confinement is necessary journeys to work, to buy food, to the doctor, etc. Organizations defending rights and interests of persons with disabilities should consistently claim to include measures to protect people with disabilities in any future crisis plans, especially persons receiving care from a family member, as they mostly receive lower support from the state than users of professional certified social services. To complement this information, I will now and to speak also about the issues of, and mostly to speak about the issues of persons with intellectual disabilities, I will pass now the floor to Milan Sverepa, who is the Director of Inclusion Europe.
Good morning. Thank you, André, for passing the floor to me and for inviting me to take part in this seminar. On the issue of Czechia, I just wanted to add on the note of social care services and the situation of families and people with disabilities who are dependent on community-based services, because these have been closed, as in many countries. And although Czechia has introduced the gradual lockdown exit plan, opening all kinds of businesses and public services, social care services are not in the plan at all. So at this time, there is still complete uncertainty about when people with disabilities and the families will be able to resume using the community-based services. So still at this point, there's absolutely no information about this. I think this is a pretty serious issue, given that they've been now without any sort of support for longer than a month, just basically being completely on their own. That was just to complement the information on Czechia, and now on the broader issue and situation of people with intellectual disabilities and families in Europe, and really I'm kind of hesitating. What can I say that is new? First of all, I think that previous speakers gave a very good description of what's happening, and it can be applied to other countries. But also, I believe that what we are seeing now as happening to people with intellectual disabilities and their families under this coronavirus emergency is actually nothing new. These are, let's say, things that has been here forever, highlighted by the lockdown, highlighted by the emergency measures, but ultimately this is nothing new. There is nothing new about people with intellectual disabilities being denied access to healthcare, like we seen the official attempts to do that in the official guidance in some countries. Like we have the cases, for example, here in Belgium or in other countries when someone was denied medical care because they screamed too much. We can also see that much of the care families are completely left without any support, as I was mentioning about Czechia, but it applies to many other countries, of course, without access to protective equipment, without access to any sort of services. Most of our members been involved in advocating for measures that would allow to make the situation more bearable. So that includes, of course, fighting for the actual protective equipment, so services carers can provide the support that is needed, but it also involves establishing for allowing for walks in the public, or like we've seen in, for example, the exceptions being granted in France or in Spain, or it can be also for the exception not to have to wear the face mask, because, for example, in Czechia that is obligatory, and the autism community, especially there, has fought to grant the exception that people with autism don't have to wear the face masks. But still, it means that people are basically locked up, and I think that this must be a very stressful and very risky situation in some context, and that's also not necessarily something that would be very, very specific, that the people and the families are kind of left out to provide everything on their own. Nor is there anything new about large residential so-called care institutions being not the safe spaces they claim to be, but ultimately very risky places full of problems, as we can all now see when these large groups of people are exposed to the coronavirus epidemic. What is more disturbing, of course, that in many places we can see there is close to no medical attention paid to this. So we will have organizations from Poland, for example, calling publicly on the authorities to pay attention to what is happening to people living in institutions. The same in Italy and in many other countries. Everybody kind of is in some way aware of the scale of the problem in nursing homes for old people. Let's say on a maybe a different scale, but it is obviously a very large problem in care homes for people with disabilities as well. There have been people dying in these establishments. As I mentioned, Poland, there has been quite desperate cries for help from Italy and from other countries, and it doesn't seem to me like this is being taken seriously at all. And let's say the last part of the response, of course, that is going on now is similar to what every other organization is doing in the disability movement, and it's trying to make sure that the authorities pay attention to these problems and adjust the measures they introduced. There is also a lot of work being done by our members on making sure that the measures are actually understandable, and so there's been a lot of work on easy to read and making information accessible, of course. For example, our Spanish member, they have also produced a mobile phone app to help people process all the information and navigate the situation. It was quite positive also to see some of the governments providing measures to make information accessible. I would like to specifically, I think, highlight the German government that provided easy to read information. And I think especially the French government did quite a bit of good work on this, providing easy to read, also easy to read formats to some of the forms that are required for people to have in this situation. Having said all that, I think that the current situation, of course, brings a lot of problems and a lot of challenges, and is incredibly adds to the already existing challenging situation with new stress, lack of social connections and support, a lack of respite for families and for people with disabilities themselves. But I want to finish by highlighting the importance of what's coming next. And I think that that would be the most serious consideration at the point as the countries start to implement lockdown exit, as there is the implementation of the economic measures and financial stimulus and everything. What worries me greatly is what is actually going to follow as an economic consequence of this situation now, and whether we are going to see, let's say, a similar scale to reduction of services and support that was possible that happened after the 2009 economic crisis, and that must be something to avoid, really. And that must be something that we will be dedicating a lot of our attention and advocacy work, because we can also see from the previous experience, I think that the current crisis and current situation is, of course, very bad and brings a lot of problems and issues. But I think there is a real danger with the economic situation now, that what comes after the economic measures and then redirecting of resources to rescue of all kinds of businesses, there is a real danger of taking away resources from disability related organizations and services. And I think that's something that we must really focus on, make sure that the authorities don't go in this direction. Thank you.
Thank you very much, Milan. I will now give the floor to Aurélie Berenguer from Autism Europe.
Hello. So thank you very much for the invitation. So indeed, I will not be able to bring a lot of new information because my colleagues have covered a lot of ground, but today I want to focus on the situation of autistic people and the impact of the COVID-19 measures on their quality of life and on the situation of autistic people and their families. So as you may know, autistic people are particularly sensitive to the change of routine. So not being able to do their usual activity and going outside can have a huge impact on their well-being and on their mental health. In some instances, the distress can really trigger what we call challenging behavior, and people can display, for example, self-injurious behavior or physically challenging behavior. So that's why in some country we've seen really a lot of efforts to lift some of the the bans and to grant more permission for autistic people to be able to go outside and to go on outings. So as it has been mentioned, it is, for example, the case in Spain and in France and in some region of Italy. So, for example, in France, autistic people can go outside for more than 1 kilometer around their home, and their their outing are not limiting in frequency and in purpose, as it is the case for other citizens. And it's also the case in Spain, where there has been a special authorization. Of course, that has been adopted following strong advocacy efforts from our members. And when it comes, for example, to the special measures, also our members have reported that there is sometimes cases of harassment and from the public who do not understand this exception, so to speak, this special treatment. So our members have highlighted also the need for clear guidance, both for the police force, but also for the public, the need to raise awareness to avoid this kind of situation. It should be noted that countries where such measures were adopted, it's indeed due to advocacy efforts and to really strong awareness raising activities, for example, in the press or in in the media, but also, I mean, our members have been acting in coalition with other organizations. For example, in Spain, Autismo España really worked in coalition with CME. In France, as also mentioned by Albert Prévos, there was a strong coalition of organizations, and all associations have been really active, speaking in one voice. So that's that was a positive aspect in that current context. Beyond concerning protective measures and the specificities linked to autistic people, but also, of course, to people with intellectual disability more specifically, Milan also mentioned the fact that in some countries, notably in Poland and in Czech Republic, our members have successfully advocated for the fact that people are allowed to go outside without wearing a mask, because it's also a matter of sensory difficulties that are linked with autism sensory issue. So that this kind of practical accommodation for autistic people are important. Regarding very practical aspects, there's also, for example, the issue of going shopping for autistic adults who live independently, and the stress that it triggers. So some people have reported very high level of stress. In some countries, shops dedicate special hours to autistic people and elderly people, for example, in order to be able to have a quieter environment when shopping. But there is also very practical issues, such as the fact of not being able to find special brands or type of food, which can be very challenging for autistic people, or the fear of not finding the things they usually eat, because some people have restricted diets. So that's concerning some protective measures. Of course, as mentioned by Milan and Albert, it's important in order to alleviate this anxiety, and also for people to understand the situation, to communicate in an accessible manner. As mentioned by colleagues, we have seen also in the autism community the mobilization of organizations to share resources and materials to help autistic children and adults and to provide, for example, social stories or document in easy to understand format. In France, also, for example, the government has launched a special helpline for autistic adults who are isolated, in order to help them in case of need. And in other countries, we see the development of such initiative, but quite often it is organized by association. As mentioned by Albert, also the lack of educational support is particularly challenging for autistic people and their families, because a lot of children who usually go to school can no longer attend classes, of course, and many autistic children need to benefit from one-to-one support, which cannot be replaced by remote and computer-based learning. It means so that in most cases it is parents who need to provide this support. It is of course very challenging when they also have to work at the same time at home. And the media, for example, here in Belgium, has reported on the particularly difficult situation of single parents who are alone to care for their children. They also face other practical difficulties, such as going shopping, in particular when there is a limitation on the number of persons for each family who are entitled to access the shops. So as mentioned previously, of course, it is a very, very difficult situation for many families in Europe who support autistic people, and of course it is made even worse indeed by the disruption and interruption of services. Unfortunately, as already mentioned, many autistic people still live in residential institutions, and we know how difficult the situation can be, even more difficult than usual with the restrictive measures. It means that people are confined to their room, and in the case of autistic people, communication, remote communication is made really difficult. So there's no way to have contacts with family in many cases. And many autistic people have also been sent back to their family who are struggling without support. So again, a need for more respite and to support families at this difficult time. In other families who usually live with their relative on the autism spectrum, there is an interruption of services and of the usual respite. So again, a situation that is more difficult than usual. It's also been mentioned, many of our members have concerns around the healthcare, the provision of healthcare and access to treatment. There's been reports of parents being told that their children would not be considered a priority due to their high level of support, as already mentioned as well. As mentioned by Albert, on the 4th of April, the health minister reaffirmed that disability could not be a motive for denying access to healthcare, but our members really remain also careful about this. In the UK, the National Institute for Health and Care Excellence has been updating also its guidance because previously autistic people were subjected to a frailty assessment, and our members have been advocating so that it is no longer such assessment that is put in place, but that there is a special assessment for autistic people and for people with intellectual disability and so on, so that their special needs can be taken into consideration. However, there is still concern, for example, that this new guidance might be also used in a negative way. So again, a need for remaining vigilant. So it should really be used to make sure that individual assessments are carried out and take into consideration the specific needs of autistic people so that they can get the right treatment. So it requires also doctors to be trained in this for that. Our members in Spain also have been particularly active advocating for the provision of accommodation in healthcare for autistic people. For example, the right to have a support person in order to help with communication, or highlighting also the sensory needs of autistic patients. So if possible, to have access to quiet space when in hospital. So, of course, we like all our colleagues, we are particularly concerned about the follow-up of the COVID-19 measures. There's also among autistic people a lot of stress about the lift of the measures and the fact to go back into normal life. It is quite stressful. And we indeed have to make sure that the future of financial impact does not affect the situation of services and of autistic people. Finally, I would like to mention that we are currently carrying out a survey on the situation of autistic people that is now available in 5 languages. So if some of you would like to answer the survey, I can circulate the link as well. So thank you.
Thank you very much, Aurélie. Indeed, if you send us the link, we can also send it in the end of this presentation to all attendees. We will now go to the open floor part of the webinar. So you can also, just to clarify, you can already start asking questions, which we will take at the end through the question box. I'll now give the floor to Luisa Bossis-Ufasi, that will speak about, and I will let her speak.
Can you hear me?
Perfectly.
Okay. Thank you, André, taking me the floor. And as said by the previous speaker, I think that I do not give you news, but are the same things that we heard in the last webinar. But because currently in Italy that are already in full lockdown, we are talking about the recovery. Association of persons with disability are wondering about the living condition after COVID. The virus fits into an already critical situation by increasing its deleterious effect. Emergency choices have negatively affected our rights. This is the proof. We are thinking about the after COVID condition in some important field that persons with disability live. The school. We are thinking about how to start again. What security measures will be put in place to return to school? Have these security measures taken into account students and pupils with disability and their different disabilities? How they can attend school, how they can use the remote learning, how they apply with the social distance using security item as mask and glasses. The access to health and well-being. In emergency, and until now, persons with disability have neither hospital nor territorial access to health. What effect after COVID will it have on services, health services, social services, community-based services? What will happen if no safe modalities of participation for persons with disability are found? Will persons with disability be asked or forced to remain isolated in their homes? We can write a new hashtag, stay safe, staying at home. We are monitoring the new Ministry of Health decree for the further period after COVID. And we saw some risk for persons with disability. Rumor, but not also rumor, also the president of the European Commission said that the last one will be able to resume life will be the elderly, no? She said that until December they cannot go out of the home. Is it the same in this Ministry of Health circular that say if we cannot protect the person with disability, we lock them up, and so it will be for elderly people, but also for persons with disability that will not go back to school, that will not go back to work, that will not have the services dedicated to them. As usual, this is our concern, is that the adoption of security measures will exclude us from participation. and it will be even more isolation, segregation, denial of our rights. These are our concern. Thank you.
Thank you very much, Luisa. I will now give the floor to Sari Hirvonen Scarpo. Hope I say that correctly.
Oh, hello. Do you hear me?
We hear you perfectly, Sari.
Yes, thank you. My name is Sari Hirvonen Scarpe. I am representing the Association for Cochlear Implant Users, and I want to remind that it's very important to we people with hearing loss, we people we don't hear very well, we are using the cochlear implants, that the communication is very important, and also the written communications are very important to us. So, for example, on the televisions, when the government is giving the information, the news information about the COVID-19, that all information which is which they have been talking about, it must be written on the television with the subtitles. And also some people prefer also to have the sign language. And the other thing is that we have difficulties with the communication with the people who are wearing the masks, because we are not able to see the faces and the lip reading. So we have to be, we are very worrying about this. There should be a more the mask which are able to see through the lips, that we could be able to lip read. That's one problem. We need to get more masks provided with possibilities to lip reading. But the situation at this moment, it's very generally is that all operations to get, for example, cochlear implants at the hospitals, because it always needed chirurg hospital work, hospital treatment. So it all stopped, mostly all the countries. And some countries, they don't given any possibilities to have the operation or to come to visit to hospitals. And EuroCIU, our International Association for Cochlear Implant Users, have made a brochure to all member countries what to do, how to treat at the hospital if the people are wearing the masks, how to provide the information with all the people with hearing problems. So this moment, all the process to getting cochlear implants is stopped now, and we are worrying when they will be starting again and how long time it takes. And also the information how to buy the batteries, for example, it's very important to people. How to get them, they can buy the shops, for example, but if the shops are closed, what happens by then? So these are few examples what is affecting to people with the hearing loss. Thank you very much.
Thank you very much, Sari. The next speaker will be Irene Beltana. I'll give you the floor now.
Hello, everyone. I am Irene Beltana, Advocacy Officer at CFHE Families Europe, which represents families and also families with members with disabilities in Europe. Here again, it's difficult for me not to repeat what the other speaker said already, which I confirm also from our membership. So yes, families have been affected disproportionately by COVID-19. And this crisis is also deepening the inequalities in between countries, in between incomes. And so for sure there are some problems that are more difficult where the support is not there, where the financial stability is not there, and when the social network is not there for the family. So there are some risks that are the risk of isolation of the members with disabilities in institutions, and the lack of communication between the person with disability and the family members, which has a lot of consequences in terms of anxiety and mental health. And then we have families that had to decide very fast if they would take their children back home, but that might lack the proper devices to properly care for these children and adults with disabilities. So these families need respite. They need flexible working arrangement and leaves in case they are working and they need to stay home to care for their members, family members with disabilities. And this is something that maybe was not so much highlighted, that we are like working on as CFHE. We are calling for an assessment of needs of families, and because the risks are indeed the loss of financial stability, physical and mental health. Our members are very active as the members of the other networks in providing information, accessible information, also support, Q&A for family carers about what they can do in order to support their family members. We are calling for respite. We also have some members working on early intervention, because there are some branch of disabilities where it's very important to ensure the continuity of care, but also of assessment, because a delay in the intervention can cause long-lasting damage. And we are realizing that partnership is fundamental to get results, and this works. And we saw a positive example, as already mentioned, in France and Spain, for ad hoc rules for families and persons with disabilities in confinement, and other kind of support. So I think I would close here. Thanks a lot.
Thank you very much, Irene. We have someone else that asked for the open floor. This would be Sorin Tata. Is Sorin with us? I will let him speak now.
You are self-muted. Now you can speak. Can you hear us? Hi, Sorin, can you hear us? Sorin, you are self-muted, so you need to unmute yourself. You have an icon for the microphone on the left side. Okay, André, I think you can continue with questions.
Yes. And okay, I will pass to the questions, and then Sorin, if you manage to speak at any time, we will pass to you. So feel free to ask questions in the question box. We have a first question to Albert Prévos, and the question is regarding subtitles. So Albert, can you inform us about how subtitles on TV, on programs or broadcasts related to coronavirus and press conference related to coronavirus are organized in France?
Well, thank you. My digital link is quite intermittent, so can you ask me the question again, please?
Yes, I'm sorry. It's regarding subtitles in TV broadcasts related to the coronavirus broadcasts.
Yes.
What is the situation in France?
Well, it's not related to coronavirus crisis, I think. But what we have at the moment, we have systematically, when the government is saying something about the crisis, we have not exactly subtitles, but how do you say, I don't know, with what it's
Is it live captioning, maybe, fellow typing?
Yes, it's live captions, and also what we are doing now at this meeting, we have the language by sign language beside the people who are speaking when it's an official move, or when when the minister is speaking, for instance, or the president is speaking. Now we have sign language systematically.
Okay, thank you very much. A question now for Aurélie. Could you repeat what you said about the special hours in shops for autistic people? Do shops offer that regularly, and could you share more about how it works?
Yes, do you hear me? So it's basically certain times in the day that are reserved for people, for example, on the autism spectrum or elderly people. And so it's at certain time of the day, and they are, for example, in the UK, they're sometimes called quiet hours. And so I think you do need a decision from a specific chain to implement such a scheme, but it's developing across Europe. I've heard also of cases in Malta, for example, and in various countries. So it is to allow for a quiet environment when shopping. And for example, the light can be dimmed so that it's not too much in terms of sensory overload, let's say. I don't know if it answers the question.
Thank you very much. I have another question regarding more for all the panelists regarding their information, and this is regarding again subtitles. So in the countries, do you know of countries where there is possibility for television broadcasters to have this live caption or subtitles, or do you know of countries where this is not happening? I will maybe start by giving the floor to Milan, then Aurélie, and then I can complement if they want to speak on this.
Sorry, André, on subtitles specifically?
The question is if television broadcasters are giving the possibility in other countries to have subtitles on television. If the attendees also want to share, they can put in the chat, and then I can read about the situation in their countries.
Yeah, it's not something that we follow so closely. I can say maybe on Czechia, I can see from the news that they started to use, they didn't have it from the beginning. They had a sign language interpreters. I'm not sure about subtitles. Yeah, sorry. That's it.
I think I can share from what we hear in EDF, which is not too much. We know that in a majority of countries, subtitling and sign interpretation only came after advocacy from the organizations. We do know the specific example of France that has indeed live captioning in all the addresses of the president. And I believe Italy also has a system of subtitling. Finland has a special channel for, I want to say channel, but it's a teletext channel, which I don't really know how to to translate this. And in Germany, there is a TV channel where every action of the government is subtitled, if I'm not mistaken. Don't know if any of the panelists wants to complement. Okay. If not, we will try to now pass the word to Sorin Tata, and we'll see if he can make his intervention now. I think you're unmuted, Sorin, so you have the floor. Sorin, can you hear us? Okay, we will contact you, Sorin, and we'll share your updates in the upcoming email. Well, thank you very much for the speakers, and thank you very much for all our attendees, and of course, sign language interpreters and live captioner, and my colleague Raquel. We will make the recording available in the next few days. We'll need to subtitle to have it professional subtitle. Any further questions that you may have, you can send it to me. If you have, and I will also send them to speakers so they can answer a bit more clearly. Thank you very much, and have a very nice day.